Hello and welcome. You're watching our special show, Coronavirus Facts versus Myths. This is a show where we get you all the latest on COVID. Also, we'll have doctors answering any questions that you may have. Do call up this number on your screen for any questions regarding COVID or vaccinations that you may have. Now, first, let's get you the latest numbers. And India's daily COVID cases dropped below the 3 lakh mark for the first time since April 21st, with 2.81 lakh fresh infections reported in the last 24 hours. Though do remember, over the weekend, testing is also much lower, and usually we do see a dip in cases on Monday. However, deaths continue to be over 4,000. 4,106 COVID patients have died since yesterday. Now, while vaccine shortage has dampened the world's biggest inoculation drive launched in January, Health Minister Harshvardhan has said over 51 lakh doses of vaccines will be received by the states and union territories in the next 3 days. But just take a look at the numbers, and the total number of vaccines given so far is 18.3 crore, while on Sunday just under 7 lakh vaccines were given. As many experts say, the number should be over 50 lakh. The last time it was over 20 lakh a day was on the 13th of May, when over 23 lakh vaccine doses were given in a single day. Now, the big focus on the show, a look at COVID treatments and convalescent plasma therapy, which is widely used in India to treat COVID patients, is likely to be dropped from the ICMR clinical protocols, according to reports. Recently, a study published in the British Medical Journal also suggested that convalescent plasma therapy has shown a limited effect in reducing the progression to severe disease or death, and the randomized evaluation of COVID therapy, or recovery trials as they referred to in the UK, has also found that the use of plasma therapy on hospitalized COVID patients does not improve survival rate. This study was even published in the Lancet. Well, to talk more about this, we're joined by Dr. Rahul Pandit, member of Task Force on COVID Maharashtra, and Dr. Sunila Garg, member Lancet Commission COVID India Task Force. Thank you so much, doctors, for joining us. And this is something we've spoken about, I think, for over a year. We've been speaking about plasma therapy. And Dr. Rahul Pandit, first to you, this is something that is extensively used across India, even though we have studies after studies that have shown that plasma therapy does not help. How do we change this?
I think there is enough data now in the literature to say that plasma therapy has not actually shown any benefit in any of the trials which have been published across the world. I'm not just talking about the Indian data, I'm talking about the data coming in from the world. And as you rightly said, that the British Medical Journal and some of the other societies as well are talking about not using that as a part of a standard treatment, and so is ICMR probably thinking of it. But what's important to know is that information gone down to the last person who is actually at the grassroots level, who is working and ordering this or requesting these for the patients to get through. And what I believe is that where it is sort of giving them a little bit of a leeway is that we have still said that it can be used for a compassionate ground. And when that compassionate ground comes into any part of medicine or a medical therapy, everything takes a backseat, that we are giving a compassionate ground. And I think that needs to be clearly defined, that there is no role for plasma, neither compassionate nor non-compassionate. Then that's the only way to actually make a very clear understanding for people that please do not use plasma.
Right.
Because what is happening is that relatives are running around trying to procure this, and then when it is given to the patient, it definitely doesn't make any benefit. But it's like a large volume of fluid given, which may probably be counterproductive in the later half of the illness. And when they are actually in ARDS, we are very, very cautious of giving blood products in the ARDS fracture, ARDS part of the illness. And that should be definitely not given.
Right. Dr. Sunila Garg, how do we tackle this? Because there's so much energy that is spent on trying to procure plasma in the first place. Even, medical fraternity is taken up in this entire process of getting plasma. And the message needs to go out that, it just does not work. It needs to urgently be dropped from the ICMR, advisory so far.
Yeah, thank you, Gargi, first of all, and thank you, Dr. Rahul Pandit, for making my job a little simpler. Now, this is the trial which has just been published on 14th of May. This was recovery trial carried out on about 16,000 plus individuals, and the trial showed that both in the control arm and in the the arm in which we gave the plasma therapy, both remember, 24% of the individuals, they died, at the end of 28 days. And also, you see, basically, it showed that even progressing to ventilation also was not different in either of the groups. So, and this has been carried out not in one hospital, but in 177 hospitals of NHS and being carried on still. So what I feel from the public health perspective is that we have to urgently review these guidelines, and I'm sure Dr. Pandit will agree with me that there is a need to standardize, basically the management protocol of all our healthcare providers, so that, people don't have to run in midnight and all, just, procuring plasma, which has got virtually no effect. And I think, kind of, even if 1 or 2 people have recovered or 10 people have recovered, we have to see from the perspective of science that, this is really effective or not, because we are going on opening the plasma banks and all.
Absolutely.
That we need to look at it from the correct perspective.
That was like, earlier when we were very hopeful this would work. And very briefly, I want to know, there's also some talk that this leads to mutations. Is that correct? Some, scientists have said that ineffective therapies lead to mutations. What can you tell us on this?
Definitely, basically, you see, when you are, Dr. Rahul, you will take this question, or should I answer?
Please answer.
Go ahead.
So primarily, I feel that whenever you are giving, plasma from another person's individual, so the antibody, basically the virus is going to protect itself. So it is going to mutate. So primarily it is something like, because it is going to change the character. In any case, the basic character of the virus is just to save itself, So that is why, the virus changes the character and mutates. And this is one of the important reasons which we have to keep in mind, that also it is not effective. It is causing mutations. So of what use is this plasma therapy, which we are, it has got lot of cost to it. It has got lot of, kind of misinformation to it also.
Right, and we even hear of people, demanding money in exchange for giving their blood. Well, let's open this up for callers now, and we have a caller from Mumbai, Suresh Salvi. Go ahead with your question.
Yeah, my dearest friend is having constantly the platelets count of 70,000-80,000 between that. You see, whether he should go in for vaccination, take the vaccine, or what is your advice, please?
All right, Dr. Rahul, so very concerned friend there. Go ahead.
Look, if this is a chronic problem, which is low platelet count, then there is no reason why he should not be taking the vaccine. He can go across and take a vaccine. The only thing he needs to remember is that because of low platelet count, there might be a local injection site pain or hematoma. So as long as he presses with a bit of a cotton immediately after the vaccine shot is delivered and keeps the pressure on for a few minutes, more than what normally one would do, that should be fine.
All right, we have a tweet question from P. Shinath. Can people with allergies, I'm allergic to penicillin, he says, take the COVID vaccines or not, Dr. Sunila?
Yeah, it's a very, very common question, that whether to penicillin or to other antibiotics, this has got no relation with the vaccination. So I will say that please forget your fear and go ahead and take the vaccination. And if at all you are so scared, you just inform the doctor. They will also give you some anti-allergic tablets. But you must go and take the vaccine, because any antibiotic has got no correlation with taking of these vaccines. That is important.
All right, another tweet question from Kaushik Ram. He says, can I take a combination of vaccines for my 2 doses? Here, people are not getting even 1 dose and he wants to take 2 doses. He says, like Covishield for the first dose and Covaxin for the second dose. He talks about data from trials in the UK have been released, and he says also France and Germany are doing these tests. Dr. Rahul?
Look, there is no data for that right now. Please don't try and mix and match vaccines right now. Let's follow the national vaccination guidelines which have come across, which is stick on to the same vaccine for the second dose, please.
Right. I think people are reading a lot about these trials and, getting confused and misinformed. We have another question, Sunny, who tweeted, when to take the second Covishield vaccination if the person gets infected with COVID after the first jab. This is something that we hear a lot about, Dr. Sunila.
Yeah, recently the guidelines have been changed. Earlier we used to say that take within 3 months, but now we say take after 6 months. So he has taken first jab, then he got the infection. Now he has to take the second dose after 6 months, because first antigen he got through the vaccine, then he got through infection. So virtually like 2 jabs, and then he has to take the actual jab after 6 months. So these guidelines have been revised just 2 days back. So he has to take now after 6 months.
All right, after 6 months of getting the COVID infection, even if you've taken that first jab. Thank you so much, Dr. Rahul Pandit and Dr. Sunila Garg, for sparing your time and answering all those questions for us.
Thank you. Bye-bye.
Well, with that, time for us to slip into a short break. On the other side, we take a look at how tech can help in dealing with the pandemic. Welcome back. Now, at a time when the pandemic is peaking in India and resources are scarce, can virtual monitoring of patients help ease the pressure on hospitals that they are facing currently? Now, British health tech firm Huma helped the NHS during the spike in cases in the UK in creating virtual wards in some areas to monitor and care for patients who had moderate symptoms of COVID while they were in isolation. Patients had to fill out their details, their oxygen levels in the app 3 times a day, and then they were monitored virtually. The aim is to see how healthcare teams can get patients to hospitals at the right time for better outcomes and better support them through early interventions. Huma now wants to urgently help in India in any way that they can, given the pressure on health services and hospitals here, and they want to do it pro bono. Well, to talk more about this, we're joined by Dan Vahdad, founder and CEO of Huma, and Dr. Matthew Knight, consultant respiratory physician with the NHS. Thank you so much both for joining us. Mr. Vahdad, first to you, tell us about Huma Health Tech and how did you help during the COVID surge in the UK?
This is a good question. So as you know, Huma, we have been active for many years in the field of bringing digital first care hospitals at home across different diseases, from rare disease to chronic diseases. And when COVID happened, we decided, the whole company and all of our partners, to put our efforts and focus to build a technology that we call it COVID Hospitals at Home, together with our partners, UK government, Germany governments, clinicians and healthcare systems in those centers, so that we can keep patients and deliver care when they are still at home. And if only they need to come to the hospitals, they can come in and utilize basically hospitals' limited resources, oxygen devices, and so on and so forth. And the way it works, it's very simple. It's a simple application. When you have COVID, it gets prescribed to you almost like a pill. And then the applications tells you what to do, how to do it, when to do it. It connects to certain devices like oxygen saturation device, which is a very important one. And then all the data and insight goes to the clinical team in the hospitals. And then suddenly we can flag someone might have hypoxia, which, as you know, quite dangerous for the COVID patients, or someone is deteriorating. And then clinical teams can remotely intervene, have a video call, ask patients to do certain things and manage it all at home. Or if the patient really needs care, only bring it when the care is needed.
All right. So, Mr. Vahdad, how do you think you can help in India, especially since this is all tech-based, it's app-based? Would this involve you tying up with hospital groups or local governments?
Yes, we've been observing, because we also have a team in India, and the stories was really sad, and we really felt we have to do something, and we were thinking, how can we bring all the learnings and experiences we got in Germany and UK to India? And as a result of that, we committed to do this initiative pro bono for the time being, especially right now that there is a huge urgency of help. And by bringing our COVID hospitals at home, helping certain hospitals and healthcare systems to double their capacity, hopefully, but also enabling the wider reach to rural areas, because that is where most of the challenges usually are, and all the other benefits that simple technology like this can bring. And as a result of that, together with our ecosystem of our partners and help of certain governments, we are in contact and collaborations with different states, cities, and healthcare systems. We are due to go live in Pune with a first series of our projects to impact hopefully a large number of patients. And the beauty of our technology is we can roll it out really fast. At the time, we had the day that we rolled it out to 100 clinics/hospitals here back in Europe. And hopefully we can repeat the same things with some impact during this really hard time for India.
Well, Dr. Knight, I'd like you to come in here and, tell us what you think about the India situation and how this technology could help. This is something that would apply more for, our big cities and our big hospitals.
So I think that the benefits are threefold really to the use of this type of technology. It's very simple because it requires only the upload through a smartphone of very basic data. But the benefits are to the patient because it allows the patient to be kept at home, to communicate with their physician, to be reassured. And anxiety is a big contributor to the need to see a doctor. And it's a very anxiety-inducing period of time when you see people all around you being unwell. And I worked in Tamil Nadu for a year and a half many years ago. I have a lot of friends in southern India particularly, and likewise as it was in England at that time. Reassurance is very important for a patient, knowing that they're safe, or if they're not safe, having a little bit of time to be able to plan a hospital admission is really important. To the physician, it's a big time saver. It allows local doctors to be able to manage far more patients, as well as tend to the needs of other patients, because all the people with heart attacks and strokes and cancer, they haven't stopped getting sick. Those patients are still there, in addition to all the new patients.
All right, so Mr. Vahdat, have you thought about rural areas? Because that is where we're now seeing this pandemic spread. How would you, manage to help in these rural areas since there is a technology challenge?
Definitely. Obviously, we are still in a learning curve in terms of the best way to support different part of the countries. We would need as many help as we can get from different healthcare systems and governments and groups that are focused on delivering care to patients. It's a teamwork. The beauty of technology is it does not require any presence. When we rolled out our technology in Germany, we had 0 person in Germany on the ground. So the fact that you can deploy these solutions all remotely, I think is a plus. And in terms of technology requirement, it does require some minimal technology like connectivity, some simple smartphones. Hopefully in each family, there's at least one person that might have access and they can use that phone and share that phone with the patient and for the patients potentially, or sometimes people have it and that's kind of the approach we are taking. But anyone that can help to help us to put our technology in more places and impact more people, we would love and we would welcome that.
All right. Well, Dr. Knight, again, how comfortable are patients using an app, to imagine that they're being monitored virtually?
So our feedback was very good from patients. They liked it. They liked the fact that the thing they liked the most was actually getting an acknowledgement from the doctor that they had seen their data. They felt reassured by that. We allowed patients to select whether they wanted to use the app or not. So in our particular cohort, about 50% of the patients that we offered use of an app for accepted it. The most common reason for not wanting it was because they didn't have a smartphone. And even that time saving allowed us to just proactively telephone the patients who didn't use the app. And so we didn't have everybody using the app, but the 50% that did meant we saved so much time. We had time to telephone the other patients and sort of proactively phone and get that data in. So for patients who used it, the feedback was very good. They liked it. Had feedback from patients that they liked looking at their numbers on the phone, because you could look over the trended data and you could see, well, I was 93% SATs 7 days ago. I'm 95 today. My heart rate's better. And you can see that visually. So when the doctor does contact you and says everything's getting better, it's reinforced. You know, well, I still feel bad because I've had COVID, it's a nasty infection, but actual fact, objectively, I'm better than I was a week ago, and that's a good news. That's good news. So it's very reassuring for patients. So as well as saving a lot of time for the system, allowing patients to be safer, we have anecdotes of patients who actually didn't feel that unwell, but their oxygen levels were going down, and we proactively admitted those patients to hospital.
All right. Finally, Mr. Vahdat, now it's very fascinating to see how technology has expanded into the healthcare sector. Before the pandemic, we didn't even have too much medical telecounseling here in India, at least. And now everybody is doing it. Of course, your app involves a lot of artificial intelligence.
That is true. I think pandemic and the pressure that it put in healthcare systems globally forced everyone to be more innovative and adopt technology. And the beauty of technology is simple, scalable, and relatively cost effective. And in some scenarios, even also very safe, because if you can manage your chronic conditions or preparations for your surgery or any other diseases as much as possible in the comfort of your home during the time that a pandemic is happening and you might be exposed to the virus if you travel, as an example, I think it becomes almost no-brainer. And the impact and the stats that has already been published from the works that we have done, it shows massive savings. It helps some healthcare systems to double their capacity, reduce admissions and readmissions, but also more importantly, help the limited resources to be delivered to the people that they need it at the right time. Even, if a patient gets sick and come too late in the hospitals, that the same patient would take a lot longer to heal. And that means taking a lot longer bedtime, oxygens, and other technologies that the hospitals has. But if you bring it at the right time, you might be able to look after the same patients in 2 days instead of 20 days. And that is the opportunity.
All right. Well, Dan, Avadat, and Dr. Nai, thank you so much for speaking to us here at NDTV. Well, that's all the time we have on the show. Thanks so much for watching. Goodbye.